Dr. Alan Cadiz, welcome to the Awesome Dad Show. How are you?
I'm doing great. Glad to be back here. Thanks, man.
Yeah, welcome back. Very excited. Our last episode was very popular. If you haven't seen it yet, definitely go make sure that you check that out. But I'm glad you're on because, Doc, I got to say, I am terrified. I am worried. I think it's the end of the world. What's going on with coronavirus? Should I be worried?
I would say no, but maybe. um,
Okay.
so this is a new thing, and we're still learning every day about it. I think there's now 11 cases the last I checked in the U.S. Um, symptom wise, I think it's somewhat very similar to the flu,
Mm.
where fever, cough, shortness of breath, achiness. Um, it's probably more harmful to the immunocompromised or people with bad immune systems, or the elderly or the real young kids. So people who are at risk for other infections or who have chronic infections. They're still learning every day, and they're luckily there's amazing things. I think they got ahead of this one really quick in China. So I think there's been some other viruses in the past few years, like the SARS that came out of China as well, that they were kind of slower on. So the good news is I think we're on top of this, and the travel bans and everything should be helping. Um,
It's pretty intense over in China. They've got people just locked up in their homes, completely quarantined, right? How
right,
is this?
right, yeah.
How is it passed? Do we know how the coronavirus is actually passed?
So we're thinking respiratory droplets, just like any other viral, respiratory infection. So saliva, coughing on someone, touching a doorknob of someone who coughed into their hand who has the virus, close quarters, sharing drinks. So more respiratory droplet as of now, but they don't know fully yet. They don't know fully yet. But like other coronaviruses, because coronavirus is actually a common virus that we see daily in the office. It's on one of the causes of common colds in kids,
Huh.
and and there's nothing to treat it or anything with, but this is just a newer strand of it that has come probably from animals in China, or it's crossed into humans. But that's why we're a little bit hesitant to know where's it going to go from here. But the typical coronavirus is very common. So we run viral panels in this office on sick kids, and coronavirus comes back a lot, and we probably very common. But
Hmm.
but
It's
yeah,
like a different strain of the
right, just a little bit
coronavirus, though.
different strand of it that most likely would give similar symptoms, but we just don't know. So,
Hmm. Hmm.
um,
So how
you
do
know,
you know that, hey, so someone goes traveling, which I'm assuming is probably something you might want to be hesitant about, like traveling overseas, something you should be a little bit more worried about, or maybe not so much?
I think traveling to China, but if you're going to other places, I wouldn't call it off limits at this time. At this time again, but uh, China absolutely not traveling over there right now until they get this thing figured out.
Yeah.
And
Yeah.
so if people ask me, oh, should I be worried about it right now? He's got a cold. Well, have you been to China? Have you been exposed to someone who's been to China? Those are part of the requirements of diagnosing this right now.
Yeah.
So that's not very common here around
But don't you think there's a possibility that maybe someone is carrying the symptom dormantly and then they go and they use a water fountain and then use the water fountain? I mean, I think that's the real fear
right,
about how something
right,
like this starts, right?
right. But as of so as if this spreads more and more, then that will be a fear. But as of right now, it's still limited to not even thinking of, as a physician, to order laboratory testing for it unless there is that exposure. So that is absolutely a fear in the future, that if this continues to roll on, that yeah, that just like any flu, that's how you can catch it.
At what point, if someone suspects that they have a problem, whether it's the flu or coronavirus or something along those lines, at what point where the symptoms get bad enough do you think that they really need to get in to see the doctor? Because I'm the kind of guy where I'm like, I'll be okay. I'll just fight it off a few days, and then 5 days later, I'm like, wow, I'm really, really knocked out. When do you think they should go see the doctor?
It's kind of different for everyone, and depending on what your other medical background is. But in most kids, it's probably okay to have a fever for 2 to 3 days and see how they're doing, as long as they're drinking, as long as they're not lethargic, as long as they're you're comfortable with the way they feel, with the way they're looking. But again, like pediatricians, that's what we're here for, and we get people that bring the kids in on the first hour of fever. I had 2 or 3 visits like that today, and if that's what makes the parent comfortable, that's what we're here for. But as far as really needing to see a doctor, I'd say prolonged fever, absolutely more than 4 or 5 days. You know, shortness of breath, and now now I'm talking more ER kind of stuff, but shortness of breath, lethargic, not drinking, dehydration, so not peeing at least every 4 to 6 hours. So those are things where they should seek medical attention right away.
If my kid decides that she doesn't want to eat pizza anymore, should I be worried? Because I've been running into that recently.
Yeah.
Like, what kind of kid doesn't like pizza? We need to get you into the doctor
Oh
ASAP.
yeah, she's sick. She's sick. Absolutely. No pizza or chicken nuggets. Oh, got to get seen.
So something wrong. So
We offer candy. I don't know.
yeah. Oh, forget about it. You give her cake. No pizza, but cake all day. This morning at 7 a.m., she's like, cake. I'm like,
Uh,
how about some oatmeal? Let's
good
start
test.
there.
I should use that in the office. Sick or not sick? Here you go. You want a piece of cake? Oh, they're fine. Yeah.
They're good. Good deal. So I have another question. I've talked to a number of parents, either at the playground or just at different play dates, that sort of thing. Lingering congestion, lingering kind of like coughs, right? It seems to be really common. Maybe it's the time of year. What should we be worried about when we talk about lingering coughs? How can we combat that? When should we be like, you know what, this nasal thing, this cough has gone on long enough? What are your thoughts on that?
Great question, and really one of the most common visits in my office as well. Basically, you think of a few different reasons for a lingering cough, and I'd say a lingering cough would be, to me, over 2 to 3 weeks. So most viral coughs can last about 2 to 3 weeks in kids.
Mm,
One of the most common reasons for what parents call lingering coughs is a virus that they have in the school age, or preschool age, 2 or 3 weeks. In the meantime, they get another virus on top of that, and in the meantime, they get another virus on top of that. So
mm,
now we got almost 2 months of coughing, most likely repetitive viruses. Allergy is a big one. So allergic rhinitis, different times of year, dust, dust in the homes, stuffed animals, all these little environmental factors can cause allergic rhinitis, and that could lead to prolonged coughing. Those are particularly at night, um, morning time, worsening cough in the morning, nighttime. So, we could talk about treatment and probably another time for those. But and then there's pneumonia and bacterial coughs, which are much less likely in the population I see in children. So that's kind of the last thing we think of. And then there's asthma too, or reactive airway disease, where you get tightening in the airway in certain situations that can lead to a
mm.
lingering cough. And then you can start to pick up, yeah, there's nighttime cough, or she's running around the park all the time, she's coughing more.
Yeah.
But definitely, after 2 or 3 weeks of a lingering cough, it's time to get checked out and go down those pathways to find out what's going on.
One of the things that I particularly am very passionate about is getting my kids outside, right? Because when my kids are inside all day, they're just a mess, right? They're just tearing off the walls. They're coughing all over everyone. I'm trying to take a nap. I'm getting sneezed in my face. Um, do you think that it's possibly not helping to get them outside when they've got this kind of like cough thing going on? Maybe don't work them quite as hard. Do you think that that's a positive or
Right. I
negative?
mean, yeah. Again, depending on which one of those causes it is, for
Yeah. Yeah.
allergies, it may be outside that's making the cough worse. Or if it's asthma, or then yes, we want to rest that kid, so we're not getting that constriction of the airway and making them cough more when they're exercising. So yes and no, but then there's some viral illnesses that it's okay to get them outside, get that fresh air, and help the respiratory system. So it kind of depended on what the actual problem is. But I'd say if you take your child out and they're coughing a lot more, then it's maybe not good to be out there.
Yeah. Yeah. Well, I have another question about being contagious and whatnot. Um, is a small child more, less, or the same contagious as a full grown adult? Because I kind of feel like, it's a tiny human. They're probably not as contagious, but maybe they're more, what's the deal with,
You
with being
mean
contagious?
if the child is sick, are they more
Yeah,
likely to get
exactly.
something
If I've
else?
got a 3-year-old that's sick, are they going to be more contagious than a 35-year-old that's sick?
More contagious for somebody else, right?
Correct.
Is that I don't. That's a great question. I don't think it should make a difference. It depends on the virus or whatever's going on. So different viruses have more contagiousness than others. Like
Mm,
influenza is a very contagious virus. The Coxsackie virus that causes the hand, foot, and mouth. That's a very contagious virus. So and it's in for instance, that one, Coxsackie virus, usually is not contagious to adults because they've had immunity to it. So it
Mm.
really depends on the virus itself. Is it one that you develop immunity to, or is it one like influenza where new strands come out and they're not? So, you know, there's no more contagiousness of a kid to an adult. It depends on the virus itself. Yeah.
I guess that makes sense. And I mean, as far as being contagious, the other factor is that a kid will sneeze in your face and not blink, whereas an adult will typically,
Right,
vampire cough
correct,
into their
exactly.
arm.
That's why, in preschools when the kids are touching everything and
Yeah.
sneezing on each other and putting their hands in other kids' mouth, that's where all the things are getting spread.
Yeah. I don't know what it is about being a toddler where everything looks like a candy bar. Literally everything.
That's their way of exploring the world. Yeah.
It's fair enough. That's fair enough. Like I had to tell my daughter about 6 times yesterday, stop putting your mouth on me. It just comes with the territory.
Hey, Mark, real quick, I brought up influenza, but
Mhm.
one of the things I was thinking about with the coronavirus and the hysteria that's kind of going on, um, you know, if I gave a name to a virus, say JX7Y virus is coming out, and it's infected. There's 10,000 deaths this year. There's 650,000 people infected every year with it. Wouldn't we all be pretty scared? And that virus is the flu. That's influenza. So I
Wow.
don't, it's a good time to remind that this is the peak season of influenza. We've had, I think, 200 pediatric deaths. We've had 50 deaths alone in Florida, where I live,
Wow.
in pediatrics, and I think there's been about 10,000 deaths in the United States so far. So it's something that you know we should be probably more afraid of than the coronavirus at this time.
Well, and there's a vaccine for the flu.
Correct, and there's a vaccine, so it's like a good time to encourage that. Try
Yeah.
to get the vaccine if you can.
So I'm just curious. I don't know if you have the stat off the top of your head here, but when you look at the people that are actually dying from the flu, I'm assuming they're unvaccinated.
I believe most of them are. I don't know the exact stats for that one. I think it's like um, 20% of unvaccinated people are the ones that get infected with the flu, and only like 5% of vaccinated people get infected.
Yeah.
So mostly the ones that, from what I understand, the ones that have died from the flu are been unvaccinated as well. So
Yeah. Well, I mean, I would assume just a higher percentage.
because I think even if you get the flu shot, you still and you acquire the flu virus, which happens. It's not a perfect vaccine,
Mhm.
but there's still a little bit of immunity your body gets, and you get a little bit of protection because you're able to recognize that virus a little quicker, having had the vaccine. And then there's also 2 or 3 different strands of the virus in that vaccine, and you know you're still going to maybe get, if it's not good one season for the influenza A, it might help you with the influenza B, so it's still worth getting. And I get questions all the time, if I had the flu, should I still get the flu shot? Yeah, absolutely, because there are other strands that may circulate during that year, which maybe the shot will help you
It's a fair
with.
point. Fair point. So I want to kind of segue a little bit back to the contagiousness thing. One of the problems that you run into in preschools, like you'd mentioned, I run into my household. Once one family member gets sick, they're all getting sick, and so what could be over in a week ends up being a month or a month and a half. Any tips? What are your top 3 tips to try to prevent the bouncing of the illness? How can we stop that from happening?
Yeah, I mean, really, kind of common sense of washing hands, not sharing drinks in the house, keeping, we're talking about spraying throughout the house, but also, keeping your kid out of the school when they're sick and not,
Mm,
forcing them back in there with some Tylenol. I hear that all the time. Keeping them out of the parks, keeping them basically isolated when you have a bad virus or a fever. But at home, it's cleaning, washing your hands, not sharing drinks, not kissing in the face, common respiratory droplet precautions.
okay,
Right. And, hey, good healthy immune system is boosted with good nutrition, you know.
fair enough. Fair enough. So you want to get everyone on the keto diet, right?
No,
Something.
no, no, no. Yeah, I like, probiotics, I think are important for the immune system. Vitamins, zinc is a good antiviral
Mhm.
helper. So
Is there any particular like multivitamin that you would really recommend for kids? Something you're like, yeah, every kid should be on something like this.
no, any age appropriate multivitamin that the kid will that's palatable for the kid, that the kid will take. is good enough.
Like a Flintstones vitamin.
If I'm okay with that, if they're able to take it, you know. Yeah.
I used to love those things back in the day, man. They were like
Yeah, me
candy
too.
on.
Now they got all the
Classic.
fancy gummy and sour ones, and
I mean, you might catch me downstairs snacking, right? I want to cover a couple myths here, a couple myths, things that I've been told that my parents tell me, and then I think parents tell their kids. If you cross your eyes, they'll stay that way. Is that true?
not true. So yeah, the eyes are like a muscle, and you know, they're a muscle, so they're moved by a muscle, and they will not stick. You know, there's certain disorders that you can get where your eyes can go crossed, but in other words, just crossing yourself for fun, they're not going to stick that way. Still wouldn't recommend it for kids though.
It's fair enough. It's not exactly a good look when you're walking down the street and some kid's giving you that cross-eyed look. It's
Gives
like,
you a headache too, I'd say,
yeah, I would think so. I would think
but
so.
no, it won't get stuck because those muscles should be able to move unless you have unless you have an actual medical issue with the nerves or the muscles in that area.
Gotcha. Okay. Okay. Good deal. Because my wife hates it when I cross my eyes, and she tells me that. So Joanna, listen to
Okay.
the doctor. The doctor said I can cross my eyes all I want. All right. So back off.
You know, I still when I've done it as joke, I still get that image in my head like, oh, it's gonna get stuck.
Yeah.
No.
Right.
All right.
Right. It's like it's funny how the things that your parents kind of ingrained in you, they just kind of stick.
Exactly.
Okay. The next urban legend that I've heard is that cold weather makes you sick. And this is another thing that my wife tells me. I go outside to take out the trash without a sweater on, one day out of the year here in Florida. I'm going to catch cold. I'm going to get sick. Does cold weather make you sick? What's up with that?
No, I say it does. The good answer is no, but you know, there's a little bit of discussion behind that. So you know, cold weather, I think viruses live a little bit more and they're stronger. That's why we see the winter season. There's more spread of viruses. I think part of that too is people are indoors more and closer together more. But just going out cold itself, you shouldn't catch a cold unless you're exposed to something, unless
Mm.
you're exposed to someone who has a virus. But just being in the cold itself, no, it shouldn't cause you to get sick. Again, you're you're if you're exposed to a virus in the cold, there may be something that helps it acquire in your body a little bit more, so your
Hmm.
airway is a little more susceptible to catching a virus because of the cold. But
Sure.
the answer is no. Cold doesn't make you sick.
Yeah. But it
No.
might make you perhaps a little bit more susceptible
More
based on,
susceptible if you were exposed to something, yes. But you going out, going out in the cold to get the newspaper, or I don't know,
yeah.
nobody does that anymore. But going out in the cold, you're not just going to get sick from being in a cold. Or my wife last week was freezing at a soccer game and thinking, people talking about we're going to catch a cold out here, but no, you can't get a cold from just sitting out there.
Hey, did you kind of lean over and be like, well, actually,
No, you
I don't
can't.
think I could help. If I went to medical school and was in the biz for couple decades, I would be leaning over all the time. Like, forget about it. I'd be the most obnoxious doctor.
My wife might say I'm obnoxious, so.
I mean, we deserve it on occasion.
Thanks.
Speaking of soccer, I'm curious, how's that going? How are your kids doing in soccer? You
Oh
still
man,
coaching?
we're full swing. I'm coaching 3 teams. So having a blast. Yeah, just all weekend is soccer. So we're doing well. We're doing with my older boys. We're undefeated team right now. So
That's awesome. That's awesome. Are you guys in the I-9 or the City
no,
League?
we're the city league. Yeah,
Okay.
city league. We love I-9, but my kids have moved on to the city league and they're enjoying it. So.
That's great. That's great. And coaching are you coaching the same kids, or, is there like a
No, it's
different?
my 9-year-old son
Mhm.
has a team. It's under 10, and then my 7-year-old daughter is on a team for under 8-year-olds, and then my youngest son is 5 and is under 6 league.
Right
So
on.
the two older ones play on Saturday, so it's like really 4 or 5 hour chunk of the middle of the day, and then my youngest plays on Sunday. But I
Nice.
love it, man. Yeah, it's best part of being a dad, I always say.
I think we talked about this a little bit on our last episode, but have there been any occasions this season where a kid goes down and, hurts their ankle and you have to rush out and kind of like, I don't know.
Since we've talked last time, I kind of said I steered away from that, but I've been a lot more involved in running out there, and
Mm,
no serious injuries though. But most of the kids, they need a little massage of their ego. It's usually the injury happens after they get kicked or after they lose the ball, and I go out there and I say, hurt or are you upset? I'm upset. All right, let's go. Let's keep going, you know?
Yeah. I found that the go-to, at least for my daughter, when she falls and gets hurt, and say, would you like to drink some water? And she'll always just be like, yeah, okay, I'll drink some water. And then it's kind of like
There you
all's
go.
forgotten. I think that's kind of a key, is just trying to divert their attention away from whatever they're focused on.
Right.
That's been effective.
And in soccer, you know, say, hey, if you're hurt, you're gonna come out. You want to come out, and then the really hurt ones come out, and the ones that aren't like, no, we'll keep going.
Yeah. Yeah. So what's on the before we conclude here, what's new? What are you thinking about from a medical standpoint, 2020? What is Dr. Cadiz thinking about? What's kind of on top of mind as far as focuses for this year?
As far as medical focuses, or
Sure. Newsletter that came out. What's like the current event that's really top of mind?
yeah, I mean, I think we kind of covered today the coronavirus, the big thing in the news. But
Yep.
for me right now at this minute, it's the flu virus, which is, you know, I'm seeing 5 to 8 kids a day with the flu, and so we're getting a lot of phone calls, and my night tonight's filled with flu-like symptoms.
Yeah. And once you get the flu, you just got to get through it, right? There's no like
Yeah,
magic
well,
button.
there's treatment. There's Tamiflu medication or oseltamivir, but there's some treatment options. But for the most part, yeah, it's a virus. You fluids and rest, and you know, managing any complications that could come from it, ear infections, pneumonias, things like that.
Good deal.
Well, but
Good deal.
that right now, that is this is the season for pediatrics. You know, the winter season, and we're busy.
I believe it. It's back to school. Flu's going around. You heard it here first, folks. Dr. Cat, it's always a pleasure.
Thank you, Mark. I love being here. I love what you're doing with you know, this movement of dads, and I'm glad to be a part of it.
Appreciate it. It's been a lot of fun. Look forward to our next conversation when the next pandemic starts to break out.
Okay, great. Okay. Good to talk to you, man.
You too, brother.
All right, take care.